A successful surgeon scientist is often called the triple threat in medicine, one who demonstrates the mastery of surgery, performs innovative research, and methodical teaching. As rare a breed this surgical scientist is, few compare to the legacy, kindness, and influence of Dr. Stephen A. Rosenberg. In fact, in many ways, he is the quadruple threat. That is, one with not only the skill to operate on presidents, the ability to mentor future academic surgical leaders, one who has developed first-in-human effective immunotherapies, but also one who possesses exemplary humility. Dr. Rosenberg is the most highly cited surgeon in all of medicine and has published well over 1,000 manuscripts. He was the first to deliver gene therapy in humans, and his tireless work ethic and dedication to his patients, trainees, and families is simply unmatched. They simply do not make them like him anymore. Dr. Rosenberg is the chief of the surgery branch at the National Cancer Institute, a position he has held continuously for the past 48 years. Steve is a pioneer in the field of cancer immunotherapy and a recipient of nearly every major award in science. This video is dedicated to the life and mission of this special man.
I was born and brought up in the Bronx, in New York City. And in my early years, I wanted to be a cowboy. I remember talking to my big brother about how he and I would go out west and rustle cattle and have adventures. But by the time I was about 6 or 7, I developed what was almost a spiritual desire to become a doctor. And I've often been asked, well, how did that happen? And as I've thought about it, I think the events that occurred after the Second World War in our own home had a big influence. I remember after the war, I was about 6 years old. And I remember postcards coming back from Europe talking about how one relative after another, my parents had been born in Poland and came to this country as teenagers. Many of their families were in Europe, and most of their relatives died in the death camps during the Holocaust. And I remember as a 6 and 7-year-old just almost incomprehensibly seeing the evil that some people could perpetrate against others. And at that point, feeling so impotent, helpless to do anything about it, I decided that I was going to spend my life trying to not hurt people, but help people. And it seemed like the best way to do that was to be a doctor, taking care of people who had illnesses and needed care. And ever since then, I've wanted to be a physician, never wavered, and all through my education was planning to not only be a doctor, but also do medical research. Cancer, after all, is something that we witness in patients. We see patients who are completely innocent, who are suffering from diseases of for no reason that they can see. Their families have to stand by, impotent to do anything to help their patients. It's like the Holocaust. Cancer is a Holocaust. It takes innocent people and makes them suffer and influences their families forever. So,
with his sights set on ending cancer, Dr. Rosenberg began his long journey in medical education at the Johns Hopkins University School of Medicine, where Dr. Blaylock was the then chief of surgery.
Well, I went through an accelerated program after high school at Johns Hopkins University and medical school. It was 3 years of the university, then 3 years at the medical school with summers. And I went through that because I knew, even at that time, having graduated from high school, that I wanted to do research. And that was going to be an important part of how I wanted to be a doctor.
In 1965, Dr. Rosenberg moved to Boston, completing his internship at what was then the Peter Bent Brigham Hospital. His co-residents, including Dr. Murray Brennan, would constitute what has often been called the Magnificent Seven, by the accomplishments these promising trainees would have in the decades to come.
On finishing at Johns Hopkins, I did a 1-year internship at the Peter Bent Brigham Hospital in surgery, and then dropped out for 4 years to get a full PhD in biophysics at Harvard, which involved 2 years of intensive coursework in many of the sciences, physical chemistry, physics, certainly biology, what was known about genetics at the time, before going back to finish the residency program. And in fact, in the midst of that, I spent 2 years here at the NIH as a clinical associate. It was during the Vietnam War, and I joined the Public Health Service. And so it took me 11 years from the day I became an intern to the day I finally finished the residency program in June of 1974.
At the Brigham, Dr. Rosenberg would train under the tutelage of Dr. Francis Moore.
Right. I was fortunate to encounter a lot of very, very smart people. You learn so much from the people you interact with rather than only from books. Franny Moore was the chief of surgery at the Brigham Hospital, an extremely smart fellow who could bring a very incisive intellect to the analysis of patient care and help to bring science to modern surgery. So those were thrilling times for me to interact with people of that caliber.
It was during his surgical residency that Dr. Rosenberg would serendipitously have one of his first aha moments, recognizing the role the immune system could play in cancer.
I read very widely, but was very influenced by a couple of patients that I saw during my residency that I think led me into more immunologic approaches. Was a patient that came in when I was a resident in the emergency room at the West Roxbury VA Hospital, a place where Brigham residents rotated. And the fellow came in with right upper quadrant pain. It looked like a typical gallbladder attack, which is what it was. I worked him up and picked up his chart, and in going through the chart, saw that 12 years earlier he had been in that hospital, had been operated on for gastric cancer. He had multiple liver metastases, which were biopsy proven. He was closed and sent home and told, sorry, there's not much more we can do. This was back in the 1960s. And as I looked through his chart, 3 months later, he came back for follow-up. Nobody really expected to see him. A year later, he was back at work. And here he was 12 years later, the same guy. We checked to be sure it was the right person, went back over his pathology slides. Somehow, he was here and healthy, and one of the first operations I did as a junior resident, there was no tumor left in his belly at all. Somehow his body had figured out how to destroy his cancer. And that is one of the influences that led me to try to study not only external forces like a scalpel beam, a radiation beam, or a drug, but rather take advantage of whatever the body had as its weapon against allowing cancer to grow. And this patient's body had figured it out, and his cancer was gone. So it was possible.
Recognizing his potential, at the conclusion of his surgical training, Dr. Rosenberg would be sought after and recruited to several academic centers, including the newly founded Dana-Farber Cancer Institute, to serve as its first chief of surgery. Ultimately, he chose the NIH, and at the age of 33, he would be appointed the chief of the surgery branch of the National Cancer Institute, a position he has held for 48 years.
So when I was finishing my residency in 1974, I was approached by Nat Berlin, one of the directors of the NIH, to explore whether I might be interested in returning to the National Cancer Institute. The current chairman was resigning, Alfred Ketchum, but I was still in my residency, and I had already been offered a job as the chief of surgery at the Dana-Farber Cancer Center by Franny Moore and Emil Frey. And that's when things with me and Franny Moore turned a little sour. We recovered finally and became good friends again, but I had committed to stay at the Dana-Farber. I hadn't signed any contracts yet. We were still negotiating terms when I got this offer from the NCI to come down as chief of surgery in the Cancer Institute. And I knew that the National Cancer Institute had the resources to pursue active research in the atmosphere of a research hospital that had, at that point, over 500 beds. that the opportunities to do that, in contrast to doing it as part of a Harvard teaching hospital, were just enormous. And so I made a concrete decision that I would accept a job here at the NCI. Told that to Franny Moore. We had a very difficult hour, a conversation in which he told me not to do it. It was a terrible mistake. But I did decide to go. He was quite upset, wouldn't shake my hand as I left the office. But a year or two later, he came down and gave a lecture for us, and we actually became very good friends for the rest of his life. But I did come down, and on July 1st, 1974, the day after I finished my residency, I was appointed the chief of surgery, and it's a position that as of last July 1st, I've held continuously for the last 48 years.
As the new chief of surgery, Dr. Rosenberg would embark on a tireless path to identify, harness, and repurpose the immune system of the cancer patient. But with great power came great responsibility, and in 1985, Dr. Rosenberg was asked to be on the treatment team for President Reagan.
In 1985, I got a call from the White House saying that President Reagan had had a colonoscopy that had showed a cancer and he needed surgery performed. And would I be willing to help? I did. We operated on the president the next day. That was a Dukes B cancer, and went without incident, and the patient recovered well. Got me into some trouble, though. I was told by a prominent member of the president's family that I could not mention the word cancer in this, and I said, I'm sorry, I can't go out and give a press conference and not tell what the real situation was.
In line with his dedication to eradicating cancer and oath to transparency, Dr. Rosenberg would make headlines during a press conference debriefing the nation on the president's condition.
They said, just don't use the word cancer. I said, I'm sorry, I can't do that. And some of the president's advisors then took charge and said, no, go out and say what you want. And when I went out on the stage, and the vascular surgeon read the path report, which didn't make sense to a lot of people in the audience, they asked me to make comments, and I said the president has cancer. And that did not go well with the politicians in the White House. But President Reagan did fine. They were worried that if people knew he had cancer, that they might not pay attention to him anymore, but it seemed to me that we had to somehow demystify this cancer word and let people know that this is a problem that needed to be dealt with.
It was in 1986 that Dr. Rosenberg would have another eureka moment. Through early work in the lab, it became clear that lymphocytes played a key role in the recognition of cancer. The problem was these cells were often hard to grow and study outside the body.
But we were desperate to try to find ways to use lymphocytes for treatment. And a very important moment then was the description by Morgan, Rossetti, and Gallo in 1976 of a factor that they called T-cell growth factor that could actually be used to grow lymphocytes outside the body. That factor is a hormone now called interleukin-2. And it was only the 67th patient, a young Army commander, lieutenant commander, in the Navy who had a melanoma that had widespread. She had received interferon. She basically had been told there was nothing more to do, go to Europe, have a vacation, you're not going to last too long. She came to us. We treated her with a new regimen of IL-2 based on the pharmacokinetics, and she had a dramatic reduction of her melanoma. I remember her first follow-up. She hadn't seen any anti-tumor impacts, but we resected a lesion, and the lesion was completely dead in pathology exam. But by 2 weeks later, her tumors were disappearing, and by 6 months later, all of her cancer was gone completely. And that was in 1984, and she remains completely disease-free to the present time. So,
Dr. Rosenberg's results with interleukin-2 would be the first time an immunotherapy showed a complete and durable regression of tumor in a patient with widely metastatic melanoma. Newsweek would hail this as a landmark victory in the fight against cancer. This work would pay off when Dr. Rosenberg's team identified that the tumor itself was a harbor for these cancer-fighting lymphocytes. He wondered, could this be manipulated outside the body and reintroduced in more optimal conditions and perhaps in the correct proportion?
Well, he said famously, chance favors the prepared mind. And I just added to that, chance favors the prepared mind when the mind is at work. And so that's such an important part, as I try to teach our fellows, that to make progress in complex problems, you need to immerse yourself in that problem. Well, I did work hard, and in fact, in the first 40 years of my time here as the chief of the surgery branch, there probably weren't 40 days when I was not in the hospital for one reason or another, when I wasn't traveling somewhere. I would come in to see patients or to review lab work or to meet with the fellows every day. We called them tumor-infiltrating lymphocytes. The tumor was a sink for the immune cells that circulated through the body. In 1988, we found that these tumor-infiltrating lymphocytes that we could grow outside the body and then return them to the patient could itself cause anti-tumor responses, thereby proving for the first time that it was truly the lymphocyte that was mediating anti-cancer responses. Since we knew lymphocytes were the effector, why not genetically modify those lymphocytes to increase their activity? No one had ever genetically modified a cell and given it to a patient. And there was huge opposition against our doing that. Responses to T-cell therapy in patients with a variety of solid cancers like bile duct cancer, cervical cancer, breast cancer, colon cancer.
A forefather of modern immunotherapy, Dr. Rosenberg has fostered hundreds of trainees in his lab, whom he humbly credits for a majority of the work. Most have gone on to be chairs and leaders in their field.
I mean, I started out at the bench with my own hands in the early days of interleukin-2, but after that, we were bringing in surgical fellows, postdoctoral fellows, guiding them in the directions of what to do, and most of the data that I've ever published since that time was actually created by the hands of and minds of surgical and PhD fellows who have come through the laboratory, probably over 300 over the past 40 plus years. And I've seen it as one of our major goals to train this next generation of surgeon scientists who can not only operate but take advantage of the enormous opportunities they have in caring for patients and having access to the tissues to utilize those resources and that opportunity to create better treatments. I've always seen our goal here at the NCI not only to practice the best of today's medicine, but also to create the medicine of tomorrow.
Having made his mark as a giant in the world of surgical oncology, Dr. Rosenberg has also mastered work-life balance and credits much of his success to his loving wife of over 40 years, Alice.
But I was very lucky because when I was in my first week of my internship, I met a nurse. Her name was Alice O'Connell. And we became friends, and 5 years later we got married, and we've been married ever since. And one of the things she told me as I started doing research here was quite extraordinary. She said, look, what you do is important, and you should do it, and I will do my best to relieve you of the common burdens that might distract you from what you're doing. And Alice has done that and given me the time and the opportunities as we raised 3 daughters. It's a hard balance. It's a hard balance to reach, and I've done my best to do that. Every night I would try to have dinner with my family, although I would always very often come back to the lab after dinner. And you know, I hope I did that well enough.
Having led hundreds of novel clinical trials, dozens of first-in-human treatments, some of which are now FDA approved, Dr. Rosenberg has been awarded almost every prize in medicine. After almost a half-century of groundbreaking work in cancer immunotherapy, what lies ahead?
Well, I've been doing this for a long time. This past July was my this coming August is my 82nd birthday. At the last site visit, every 4 years, the NIH brings in up to 15 different experts in the field to review everything we're doing, and each appointment is for 4 years. That decides your budget and your progress. And of course, over the last 48 years, we've done well. Well, at the last site visit, this point came up about how was it time for you to stop doing this, and realizing that I was fairly central to this. The person who was leading the site visit debriefing in front of the entire group turned to me and said, I mean, like, what's going to happen to this program? What's going to happen if Steve Rosenberg gets hit by a bus? And I thought for a while, and I said, well, I certainly hope somebody would call an ambulance. I told him that I'd been doing this for a long time, but frankly, I was just feeling like I was beginning to get the hang of this and was poised to make more progress. I would hope that some of the work that we're doing is going to play a part in the ultimate ability to effectively treat the overwhelming majority of patients with cancer.